part of the Master Parkinson program, and we'll be hosting a seminar for you today. So our goal as a club, the McMaster Parkinson program, our goal is to raise awareness of Parkinson's disease within the McMaster community. So we've actually been affiliated with 2 organizations, and luckily we have 2 people from those organizations as well, the World Parkinson Program and Parkinson Society Hamilton Chapter. So we established our club actually last year in January, and we've been running successfully since. We've had a variety of events, a variety of fundraising initiatives. With Parkinson Society, actually, we've been able to give McMaster students a variety of volunteering opportunities in which they would go to a bi-weekly support group. So why not present the speakers now?
Okay, so our very first speaker is Dr. Rana, and he is a world-renowned Parkinson's disease educator, and he is also the founder of World Parkinson's Program, with whom we're affiliated with. And next up, after that, we have Ms. Linda Veitch, and she is the Parkinson's Support Group co-facilitator, and she lives with Parkinson's disease. After that, we have 2 student groups from a neuroscience class, and they're here. One of them is Peers for Parkinson's, and they will be here to present to you a film on the early onset of Parkinson's disease. And then after that, we have an amazing tremor simulation device that all of you can try out, and they are created by Chemical D, so that's another group.
So why not get started with the event now? So first up, we have Dr. Abdul Qayyum Rana, a world-renowned Parkinsonism educator. He's also the founder of the World Parkinson Program. He has been conducting research on Parkinson's disease and related news stories for many years, and he has numerous publications. So give it up for Dr. Rana.
So we'll try to make it interactive. So how many people in Canada are affected with Parkinson's? What do people think? Raise the hand. About 100,000. So imagine if everyone in Canada was affected with Parkinson's, how would we feel? What is the waiting time to see a neurologist who specializes in Parkinson's in Ontario? Can anyone volunteer? One more?
1 year.
One more? So in parts of Ontario, it could be 2 years, up to 2 years, and 2.5 years. Indeed, I was speaking to a neurologist the other day, and he's a young neurologist, not old like me, with gray hair. He just started his practice a few years ago, and he said his waiting time was 2 years. So how many people in the world are affected with Parkinson's? Anyone can volunteer? It's about in the world. So globally, there are about 10 to 20 million people affected with Parkinson's. And the number of Parkinson's patients will become double by 2031. So by 2031, roughly, about 30 million or 20 to 30 million people would be affected with Parkinson's. So if you put them all together, it would be like a country full of people where everyone has Parkinson's. So we have to increase our efforts to avoid any Parkinson's crisis, which could happen if we don't have enough resources at a global level. So when you ask someone what do they think about Parkinson's, a common person who does not have a medical background, and most of you are scientists and students and researchers, so let's ask what do people think about Parkinson's if someone has to describe in one sentence. Students? So some people would say shaky or slow or old or something like this, right? And so if, is there anyone who knows someone with Parkinson's? And so can anyone name 3 famous people with Parkinson's? Students.
Muhammad Ali.
Let's keep it to the students. So,
Michael J. Fox.
3, I said.
Muhammad Ali.
You're welcome.
Anyone else?
They may be deceased.
Everyone's-
Pardon me?
I'm not a student.
Actually, we are all students. We learn from
Linda
all our.
Ronstadt.
Yeah.
Pardon me?
Linda Ronstadt. Yep. Singer.
So Bob John Paul, Linda, Michael J. Fox, Muhammad Ali, Ray Kennedy, these are some of the famous people who have Parkinson's. So what is the most common symptom of Parkinson's? What do people think?
Tremors.
Anyone else?
A change in gait.
Changing gait. Anyone else?
Posture.
So the most common symptom of Parkinson's is most people would say tremor. The tremor happens in about 70% of patients. Most patients would have slowness of movement. This is in my way, so I have to walk around. So it's, can we lower this? So slowness of movement, which is commonly seen by family members, they would say that such and such person, they have slow speed of walking, or when they go with their spouse, they can't keep up with the speed of walking. So slowness of movements is the most common symptom. Stiffness or rigidity is another symptom. Most patients are not aware of stiffness. Only some patients report that they feel stiff in late stages. Early on, they may not be aware. And when a physician examines them, that could be the first sign they see when they examine their limbs. Tremor. The most common tremor is the resting tremor, which means that the limbs, when they are at rest, so hand or leg would shake on its own. This is seen in about 2/3 of patients. And as the disease progresses, patients may develop trouble with their gait. Their posture may look like this. At neck, they may be stooped, at their hips and knees may be bent over. So how long Parkinson's has been known in human history? Anyone who could volunteer? The most modern description of Parkinson's disease, which we have today, was done by James Parkinson in 1870. He was a physician from UK. He lived in London on Hoxton Square. It was a very long square, and he used to go for a walk in the evening. So he published his first essay in 1817 with the name of Shaking Palsy. In Shaking Palsy, he described 6 people. They all had same type of features, and not necessarily they were all his patients. When he spoke about them, their posture, their gait, and he described many of those symptoms. And not only he named symptoms, but also he described or he thought that this could be an effect of toxins, because this was a time of the Industrial Revolution, and he was a reformer. He was a very outspoken person. But if we look at history closely, there have been many interesting descriptions of Parkinson's before him. 5000 BC, in the Indian Ayurvedic system, they described symptoms of Parkinson's, and not only that they described the symptoms of Parkinson's, but they treated these patients with the tropical legumes, and those legumes are still the source of levodopa, which is the most modern treatment and most effective and most commonly used treatment of Parkinson's disease. So those people were almost as good as we are today. If we look at this statement, so this is saying that the king, the divine old age, has slackened his mouth and he would cast his spittle on the ground. So this is describing drooling, which could be a very early symptom of Parkinson's. And these patients, when they wake up in the morning, they don't have any other major symptoms, but they will wake up with a wet pillow in the morning. And they will go to the dentist and look at their dentures, and they will wonder why they have this kind of symptom. Now, in this description, Sager is saying that he saw a man above the age of 55, above the age of 50, so he is giving us the age of onset. The common age of onset of Parkinson is between 50 to 60, so he saw a person in mid-50s probably, and this person, he was walking or he was running, and he could not avoid stopping to stop fall. So he is describing fascination, which is a very typical symptom of Parkinson and was noted by James Parkinson as well. Here, William Humboldt, he is describing his difficulty writing. He says that I so often cause people have trouble with my handwriting. So his small size handwriting. And he was the first named patient with Parkinson. This surgeon, he's talking about the resting tremor of Parkinson's disease. The tremor of Parkinson's disease is apparent when a person is awake. When these patients go to sleep, their tremor disappears. So he is saying that Lord L's hands, they are in motion when he goes to sleep. They stop, the soul cannot control them when he is awake. And after he is awakened, they start trembling again. So he is giving us a very typical description of tremor of Parkinson's disease. So James Parkinson, as we said, in 1817 he published his essay, and behind his name today, behind his birthday, we have the World Parkinson's Day on the 11th of April. So how does Parkinson start? Does it start on both sides, or in the legs, or in the hands, or how does it start? Or if people go to bed at night and they wake up with Parkinson's in the morning? So it always starts slowly, and mostly it starts on one side of the body. Some patients, they don't pay attention, so when they come to see a physician, they may have symptoms on both sides, but if they were to be looked at initially, the symptoms are usually on one side. Most patients would say that their handwriting has changed, it has become slow, or they go to bank and the teller is not able to recognize their sign because they have changed, it has become small, or they have trouble doing buttons, they have some difficulty with their teeth, brushing their teeth. So it starts on one side, usually in upper limb, and as we said, the age of onset is usually between 50 to 60. And mostly people would think that it is a disease of elderly people. So we have seen patients who are kids, who are mid-age, in 20s. These days we see many patients in 20s and 30s. So, however, mostly about 80% of patients, they are anywhere from 40, 50s, but still we see kids with this disease. About 10% of the patients with Parkinson's disease, they have the inherited form. However, as we are understanding more about Parkinson's, this number might change with time. In young patients who have Parkinson's in younger age, their progression of symptoms is slow, and they can manage for longer period as compared to elderly patients. This data is old, but it still says that about 100,000 people in Canada, as we said before, and about 1 million people, 1 to 2 million people in the US are affected with Parkinson's. The new cases, the incidence of Parkinson's disease in any community with 100,000 people would be 20, anywhere around 20, and because this is a chronic disease, so about 160 to 200 patients, they could be in a year time in that community, which is the prevalence. And these are some of the famous personalities. About 10% of patients, they are diagnosed with Parkinson's before the age of 50, and the prevalence of Parkinson's does increase with age, and it may be slightly more common in males as compared to females. So the common symptoms of Parkinson's are slowness of movements or bradykinesia, tremor, stiffness and gait and balance problems. The slowness of movements, the physicians usually ask patients to do these movements. So instead of going fast, they will start going slow, and their amplitude will drop, their speed will decrease, and eventually after some time, they will not be able to carry out these movements, or opening and closing of hands, or hand turning, or their toe or heel tapping. So these movements, they help the physicians to make the diagnosis of Parkinson's. And Brady just means slow, like we have bradycardia for heart. So bradycardia, slow movements. The tremor is initially at rest, which is the most common and most known tremor affiliated with Parkinson's disease. However, patients with Parkinson's disease, they may have many different types of tremor. They may have action tremor as the disease progresses. But most patients will start with one hand, and it could be just their index finger or thumb, and it may go like this. Therefore, classically, it has been known as a pill rolling tremor. It could affect jaw or lips, and sometimes when patients are sitting, it could affect their legs as well. As the disease progresses, so this type of tremor will also persist when they're stretching their hands or when they're using their hands to hold a cup of coffee or something else. Stiffness is examined at wrists and elbows as well as in legs, and when a physician feels them, it feels as if they are stiff and tight, and they are difficult to move. The stiffness is different from spasticity in the way that with spasticity, when you move the limb with the speed, the tone increases. But in case of rigidity, the tone remains the same throughout the range of the movement. The stiffness may also involve neck. It may involve the legs or knees, etc. As the disease progresses, these patients have slow speed of walking. They have one side affected more than the other. Their waist narrows, and their stride also becomes short. So their upper body moves faster, the lower body moves slow. So this leads to balance problems, and these patients, if they are not careful, they may start falling. This is the common posture of a Parkinson patient when it becomes a bit advanced. So there are, in addition to these motor symptoms of tremor, slowness, stiffness, and balance problems, there is a huge list of non-motor symptoms, such as drooling. As I was just saying, that these patients initially may come to a physician with a complaint of their pillow being wet in the morning, or if they're sitting, they just have slight dribbling, especially early in the course of the disease. Their handwriting may become small. When they start writing, if you see the first loop, that may be fine, but as they continue writing, their handwriting becomes small, and when they reach the end of the sentence, if you see the T of today and T of Toronto, they're trying to write today is a sunny day in Toronto. This is a very standard sentence which we test every patient with, so there is an obvious difference in T of today and T of Toronto. So their handwriting may be, if they write very short sentence or just a word, they may look okay, but if you ask them to write a long distance, a long sentence, you can see the small size. The speech may become soft. It may be taken as a sore throat, and patients may go to see their GP, or they may be referred to ENT physician. They go through the course of antibiotics, and after so many weeks, their sore throat is not healing, so they see their neurologist, and they find out this is due to Parkinson's disease. Memory problems. These patients in the beginning of the course of the disease, they may be okay. They may have slight trouble with visual, spatial, or frontal executive functioning, but as the disease progresses, they might develop more problems with Parkinson's disease. And some of these patients would may have hallucinations and confusion. We have seen patients who would see their spouse who had passed away many years ago, or who would say that they have people who come to house, they would not be frightened in most cases, but they would be sometimes amused, but that sometimes is very bothersome for the family members. And there could be patients who become very anxious. We had a patient who would dial 911 every other day. The police would come, or the paramedics would come, and he would ask them to search in the garage or in different parts of the house that someone is hiding there they could harm. So they get very panicky with this condition. As I was saying about fascination, fascination is a typical phenomenon seen in Parkinson's disease, where these patients are not able to stop running or trying, or when they're walking fast, they can't stop, they can't change their direction, and they would fall down. We've seen patients who were trying to catch a bus, and when the bus left, the patient could not get into the bus, but they could not stop and fell down. The family brought them to a physician, and they saw several signs of Parkinson's disease. Some patients could develop depression, although most patients would have dysthymia or a mild form of depression, not a full-blown depression. Anxiety attacks and panic attacks are not uncommon in these patients, and they may start many more years before the major symptoms of Parkinson's disease. Some patients would describe fatigue. Other family members would say that their face have become expressionless. They're sitting in the house, they are not participating in the conversations, or they're not talking to other people. They're quiet for most of the time. So other non-war symptoms could be sleep problem. Some patients are reported by their spouse or their family members that when they're sleeping, they are talking very loud, they're moving their limbs, flailing, they're thrashing, and sometimes the partner would say that they were trying to choke them or kick them, and this could be due to REM behavioral disorder, and it may start many more years before the diagnosis of Parkinson's disease. And in some cases, these patients have been followed up, and they ended up developing Parkinson's disease with time. Pain is not also uncommon symptom of Parkinson's. Abdominal pain, shoulder pain, pain in toes and legs, especially early in the morning, is a common symptom of Parkinson's disease. Some patients would get tingling and numbness in their toes and hands, especially as the disease progresses. Their limbs and the hands stay in this position, which causes the pressure on the nerves, and these patients have sensory problem. The internal tremor is a type of tremor which cannot be seen. No one can see it, but the patient will say that they have shaking inside their body on one side, with the side which is affected by Parkinson's disease initially, but no one can see it. They feel it, it goes away, and comes back. Loss of sense of smell is a recently described symptom of Parkinson's disease, but some patients may say that they have no good smell on their life. They could not smell things, so loss of sense of smell could add to loss of appetite, because if you can't smell nice food, you will not have appetite for it. So swallowing problems, when these patients they start with Parkinson's disease, their swallowing is okay, but slowly they would start coughing and choking with liquids, and then they develop in late stages trouble with swallowing. The swallowing causes many problems in oral and dental health, of which drooling is one of it, and the food particles are left in the mouth, so these patients develop dental infections, and they may have poor oral health. The gait freezing is a phenomenon where they are moving or they are starting to move, and they would feel their feet get stuck to the ground, especially if they're going through a doorway, stepping into an elevator, or any sort of time-restricted activity. So these patients would feel that their feet are glued to the ground, and in spite of making the effort, they can't lift their feet. And if you give them a mental cue, such as a line on the floor, they are able to step on it, and they can break the cycle of freezing and start walking again. In this case, the legs are not moving, their upper body is trying to move, so these patients have risk of falling, and falls can have very serious consequences, such as fractures. So because Parkinson's disease starts on one side, so one side of the body may be tilted, the affected side, so these patients could get scoliosis, or if they have scoliosis, their scoliosis can get worse with Parkinson's disease. Leg cramps and restless leg syndrome is also a common symptom of Parkinson's disease. In about 1/4 of patients, they could complain about RLS, and these symptoms are especially worse in the evenings or early mornings, and they can have trouble falling asleep because of this. Foot dystonia is the curling of toes of feet in the mornings, and most patients would develop trouble with the bladder. They have to make many trips to the washroom at night time, and if they have to go to the washroom, they have to go very quickly. They are not able to hold to their bladder because the wall of the bladder becomes very hyperactive, and even if there is a very small amount of urine in it, the muscle, the trusal muscle goes hyperactive, so it contracts, and they have to run very quickly. They're not able to hold on to it. As the disease progresses, these patients develop autonomic problems such as sexual dysfunction, lightheadedness, shortness of breathing, as well as dry skin. Sweating is another issue with these patients. As the disease progresses, the posture of their fingers and hands goes into flexion, which can cause trouble with the nerves. Most patients, because they're sitting most of the day, so they could get leg swelling. Frozen shoulder is another symptom of Parkinson's, which may start much before the disease. And these patients, because they're not moving one side, so that leads to frozen shoulder. If their nighttime sleep is no good, they would be sleepy in the day. In some patients, you would see they will come in summer when they're wearing winter clothes and jacket because they feel excessively cold. Constipation is seen in more than 90% of patients. They may not have bowel movement for a week, so that becomes very troublesome in some elderly patients especially. They could be focused on it. There are many patients, especially, as I said, senior patients, if they don't have bowel movement in the day, in the morning, they would be anxious all day, so that leads to a lot of problems, and they may not feel that the medications are affecting. This leads to anxiety and so many other issues. So there is a long list of these symptoms. So Daniel is showing me the time. I think I just reached the time limit. I could never stop talking about Parkinson's.
You want to talk a bit about your research and your organization?
Sure. Sure. So in this book, we listed some of the symptoms of Parkinson's disease. Now we published another book which says 99 Faces of Parkinson. So you can imagine how the list of symptoms is increasing. So it's almost double. So diagnosis of Parkinson is by history. There is no test for confirmation. There are many other conditions which may be confusing. So it's very important that even the neurologists, they examine the patients a few times till they are certain before they put the label of Parkinson's disease on someone, because it's a lifelong condition and it requires taking medications for the rest of their life. The cause of Parkinson's disease is not known, but probably it's the interaction of the environmental and genetic factors. And as I said, there is no cure. There is a variety of medications, some new medications, but still the most gold standard, most commonly used medication is levodopa, which is used by almost every patient in late stages of Parkinson's disease. So these drugs, they help patients to move around and take care of their daily stuff. Now I'll show you one video of a patient.
October, July, August, March, April, March, January, April, March, February, January.
So you can see the slowness, the tremor affecting his hands and legs, facial masking. So what happens if patients don't take their medications? If they don't take their medication, they become slow, they can't rest, they can't feed themselves, they can't brush their teeth. how would we feel if we are not able to brush our teeth? Next slide. So these patients have to take medications every day. And there are patients, if they don't take medication, they would become bedridden, they would be dependent upon others, they have to be changed, they have to be diapered, they have to be fed. And there are patients who we have seen, they were not on medications, diagnosis was not made or late, or they were considered just old. When you start medications, they call it a magic pill. They grow, they start changing their clothes, and feeding themselves, dressing, walking with a walker, so their life changes. So there are millions of patients around the world, they just can't buy simple medication, which costs about $1 a pill or even less in some cases here, right? So these patients are not able to see a neurologist because there are very few neurologists who specialize in Parkinson's, or even general neurologists. They can't buy a walking aid, so they don't have access to literature. So how to help these patients? And as I was saying, the number of patients will be doubled by 2031. So we will have maybe more than 20 million patients around the world. So we have to develop a mechanism so that we can help patients around the globe. So what we did, we started this program with the help of volunteers, where we started with the literature. So first we developed the literature. The literature was a series of 14 brochures about various aspects of Parkinson's, like constipation, drooling, sexual dysfunction, and so on. And this literature was translated gradually into almost 20 languages. So it's now available in almost every language, and it's used in more than 50 countries. Then slowly we started getting requests for patients to sponsor their medication. So in some of the countries, the cost of the medication for a whole month for one patient is only $25 to $30. So if people donate $1 a day, we can sponsor medication of one patient who will live in Africa or Bangladesh or any part of the world. So we started providing medications. Then there are patients who can't afford buying a walker or a quad cane. A quad cane here in Canada costs about $50. So these patients, they make $50 in 1 year. So they can't buy a quad cane. So we started helping these patients. We recently completed a project of giving a shipment of quad canes in Kenya. And I have some pictures on the social media of those patients who received the quad canes, and they feel so happy. They are walking now, and it helps them to stop falling and having fractures. So some of these patients, they can't brush their teeth. So we supply them electric toothbrush because they have trouble with hand-mouth coordination and tremor. So that also helps them with the oral and dental hygiene. So I have some of the material here if someone wants to support these patients. This organization is run completely 100% volunteer. There is no admin cost, so everyone working there is putting their time. So we take the request, and then we send these supplies to these patients. Okay, I'll take any questions.
Does anyone have any questions?
Yes, you spoke about the increase in the number of people with Parkinson's over the next 20, 30 years. Is that because of the changing demographic nature of the global population, or because the disease is actually on the increase for other reasons unknown?
The exact reason is unknown, but there are multiple factors for this. Aging population, as we age, our neurons are lost slowly. When a patient with Parkinson's disease is diagnosed, 50% of their dopaminergic neurons are already lost. So as our population is aging, age is a risk factor for Parkinson's disease, so the number of the patients will increase. Also, exposure to toxins, the environmental toxins, pesticides. Most of the population in Africa, Asia, they live in rural areas. There has been an established risk factor of the rural living and drinking bad water. with Parkinson's disease. And in those countries, there are no regulations controlling these things, these factors, such as welding. So all these factors cumulatively would increase the number of Parkinson's patients.
Based on the environmental factor, are the patients clusters in certain countries? Do you see clusters of them?
This disease is believed to be a little bit more common in Europeans and Caucasians as compared to Africans or Chinese. But we believe that Parkinson's disease is equal and it affects all races. It only every country and the disease.
I'm wondering if it was like MS, where they say the closer you are to the equator, the less likely you are to have MS.
We don't have any such definite relation like MS. MS demographic is much different than PD, but there have been reports. Now there is another thought that it could be because of early diagnosis and better treatment facilities, that it's seen to be more common in the Europe and North America, because many patients may not be diagnosed in those countries where we think it is necessary.
I guess just on that topic, always trying to look at the genetic versus environmental component. You had some data up there earlier saying that there was a greater likelihood with a genetic predisposition, but then you also mentioned the environmental. So where is it? Do we know?
In about 15 years ago, 15 to 20 years ago, we didn't know much about the genetic involvement in Parkinson's disease. But since 1996, we have increasing data. Now, 10 to 15% of the patients, they have the genetic type of Parkinson's disease, and it's being discovered every now and then. We get the reports of patients affected, but at the end, the genetic type of Parkinson's disease and the adult onset, they have the same course, same symptoms, except in case of genetic Parkinson's, the onset is much younger than the adult onset. And some of the adult onset is also genetic.
Sorry, just about the genetic thing. Genetic is sort of suggesting that family members are more likely to get it. So what's been ruled out is that these family members were in the same area, or exposed to the same environmental factors, or are they diverse so the genetic stuff is clear?
There is increased risk with family members, first-degree relatives, parents, or siblings. There is a slightly increased risk with Parkinson's, even if they are in different areas, because of the genetic exposure, right? But again, it is an interaction of the environment and the genetic. Like if you see the Afro-Americans in U.S., their incidence of Parkinson is not exactly similar to people in Nigeria, because of there are certain environmental factors as well. So it is a complex combination of both genetic and the
So thank you, Dr. Rana, for